Hello and thank you so much for joining us. Whether you're watching on TV or online, I'm Anthony Robart. We are waiting for the latest update from Prime Minister Justin Trudeau. That is in about 15 minutes or so. He will walk out of his home at Rideau Cottage in Ottawa and give that address and then take questions from reporters. We'll be there every step of the way. Now, it has been 1 month, one long month for many of you, I'm sure, since the country seemingly went into lockdown and life as we know it changed. Gyms, restaurants, stores, you name it, locked their doors in an attempt to stop the spread of COVID-19. And you all made, of course, many sacrifices in order to keep others safe. Is it working? Of course, is the big question. Millions of people across the country certainly hope so. We'll explore that in a little bit. In the meantime, let's look at where the numbers stand right now and take the big picture first. There are now more than 2 million confirmed cases of COVID-19 around the world. In Canada, almost 30,000 people have tested positive. Quebec has more than half of those cases as that province approaches the 15,000 mark. Next door in Ontario, there are now more than 8,000 cases. That number just approaching 8,000. Alberta now reporting close to 1,900 cases, and British Columbia now has over 1,500 confirmed cases. Across the country, 903 people have lost their lives. So these new numbers come as Manitoba, as well as provinces in Atlantic Canada, reported no new cases on Tuesday. Now, a situation that has left many wondering how long restrictions will remain in place. Well, the World Health Organization has released a series of guidelines for governments wanting to start easing up on the lockdown. First of all, disease transmission must be under control. As well, health systems must be able to detect, test, isolate, and treat every case of COVID-19 and trace every contact, a huge job. Hotspot risks must be minimized in vulnerable spaces like nursing homes. Schools, workplaces, and other essential areas must have preventative measures in place. Also, they must be able to manage the risk of new cases. And finally, communities must be fully educated, engaged, and empowered to live under a new normal. A lot of questions there. Let's check in with Mike Lecouture, who is standing by in Ottawa. Mike, let's begin with what we can possibly expect from the Prime Minister. What are we hearing?
Yeah, we're hearing that he will be expanding or at least announcing a flexibility of the CERB, that's the Canada Emergency Response Benefit, possibly to extend to volunteer firefighters and other essential service workers who maybe have been falling through the cracks. Now, you had Andrew Scheer talking today about how many gaps there were, and opposition parties have been pointing out there have been gaps in the CERB and other measures that have been put forth by the government. The government has continually said, look, economists and business groups have said speed is what is important and not that it's perfect. And so that's what they've been trying to do in filling those gaps as they go along. Looks like they will go there today. In the last couple of days, the Prime Minister has been talking about how he's been speaking with the premiers to acknowledge the fact that workers in long-term care facilities do not get paid a lot. In fact, that's one of the reasons why we've seen that a number of them cobble together hours in different facilities, and that's how they make a full-time living. And now that those regulations have come out from the federal government saying you should just work in one facility if you do work in long-term care facilities, it could be that they will look at some sort of a top-up for those workers to incentivize staying in one place and making sure that they maintain their employment there because of the difficult conditions we've seen in a lot of these facilities. We've seen reports of some workers just abandoning their posts and leaving there because the conditions have been so difficult. Another thing that we are hearing that the government will be talking about, the Prime Minister will be, he'll be focusing on mental health. And it's interesting because just in the last couple of minutes, tweets have gone out from all levels of government and a press release from Health Canada saying that Patty Hajdu is pleased to announce the opening of the healthcare portal. It's the Wellness Together portal. It's going to be it's live now, and it's specifically to make sure that they're connecting Canadians with mental health wellness officials and to ensure that people who, as you said, Anthony, we are going on a month now of this lockdown and the making sure that people are in self-isolation and in quarantine. It really is interesting as well, considering that at a parliamentary committee today for the health committee is meeting, and we're going to have the CEO of Canadian Mental Health Association, and already they are warning of this echo pandemic, as they call it, a mental health pandemic that will follow the healthcare pandemic because people have been home for so long, and they haven't had that social interaction that they've been seeing or that they're used to. And that is the concern now. And I think that's why the Prime Minister will be addressing this today. We are understanding, Abigail Beeman, one of my colleagues, has told me that she has been asking about this, and apparently government officials have been trying to work on this and release this sooner, and it is only ready today. And that's why they're going to be rolling it out as part of the Prime Minister's announcement today.
Yeah, I wish we had more time, but anecdotally, I mean, you mentioned that mental health crisis that could and likely will emerge in many ways. Look, it's just bubbling to the surface, and you're hearing this over and over again from so many Canadians who many would not have thought would be afflicted by this. So this is sort of the silent epidemic that is emerging. And the question is, what will be done to address that? Because, look, a month is a long time for anyone. And a lot of people are looking for some answers and looking for help. We'll have to leave it there for now, Mike. But we will touch base later on, hopefully. And let's get to some other news. And more than a quarter of the world's known cases are in the United States. 614,000 people south of the border have been diagnosed. This is a sad number as well. More than 26,000 people have died in that country. New York continues to be the state hit the hardest by the pandemic, with more than 200,000 confirmed cases. And following an alarming spike in reported fatalities, 10,000 deaths in New York State alone. So this news comes as U.S. President Donald Trump announces plans to suspend funding to the World Health Organization over its response, he says, to the coronavirus pandemic. Listen.
With the outbreak of the COVID-19 pandemic, we have deep concerns whether America's generosity has been put to the best use possible. The reality is that the WHO failed to adequately obtain, vet, and share information in a timely and transparent fashion.
At a press conference on Tuesday, President Trump claimed the UN agency mismanaged and covered up the spread of the virus after it emerged in China. The UN chief is urging Trump to change his mind, saying now is not the time to reduce resources and politicize the pandemic. The United States, incidentally, is its biggest donor, contributing more than $400 million last year. That works out to 15% of the WHO's entire budget. Jackson Prosco joins us now from Washington with a closer look at what is happening in the United States. And let's begin with the WHO. And obviously the blame game in full swing, isn't it?
Good morning, Anthony. It really is. And part of the reason for that is that President Trump himself is facing heavy criticism for his own administration's response. Essentially, questions are growing about what the administration did between January, when it implemented a travel ban on people coming from China, and March, when the epidemic really became a full-throated national emergency. What did they do with the month of February? The administration has struggled to answer that, and so now it seems as though they are blaming the WHO for this viral outbreak. A few things they've done here, Anthony. One is that they have accused the WHO of spreading Chinese misinformation. There's no basis for that, but that's what they are accusing. They also say that the WHO was slow to warn the U.S. and other countries about the threat of coronavirus. But it's worth pointing out that the U.S. Centers for Disease Control actually worked with the WHO, went into China to investigate coronavirus in the early days after they were allowed in by Chinese authorities. It's also worth pointing out that U.S. intelligence officials repeatedly issued warnings. The White House also saw its own staff write memos back in January warning about the potential threat for a pandemic, and it seems as though those warnings were not heeded. But here we are now in April, as you mentioned, a staggering death toll, a staggering number of cases in this country, and increasingly Americans disapprove of the way this White House is handling the crisis, and that's why you're seeing this sudden pivot to find somebody to blame.
Yeah, and it just adds to the list, right? The media has been responsible. The Democratic Party has been responsible. I mean, you could probably add to that as well. You know, at the same time where the fingers are being pointed, there's also taking some credit. And connected to that, the delay in some stimulus aid checks. Recap what is going on there.
Yeah, so the U.S., like Canada and many other countries, is looking to help out people who've lost their jobs as a result of this pandemic. And the aid package approved by Congress here in the U.S. included checks to individual American citizens. Now, they're dispersing that money in two different ways. One is direct deposit for people who already have their tax information and bank information on file. For many other people, though, they're getting checks in the mail. It seems as though the U.S. Treasury Department, headed by Trump's hand-picked appointee, Steve Mnuchin, has decided that the president's name and signature should appear on those physical checks when they're mailed out. That is highly unusual. It has never happened before because the president is not writing these checks. This is not his money. The money is coming from the U.S. Treasury. But as a result of putting the president's name on those checks, it seems as though there's going to be a delay in sending that money to American citizens. A few days is what we're hearing. In other words, people who are waiting for that money will have to wait a little bit longer so that the president's name can appear on the check that they're getting.
My goodness. All right, real quick, before we head back to Ottawa, we mentioned the death toll soaring in New York. Interesting way to interpret these numbers. What's the reason behind that?
Yeah, I've been talking to epidemiologists about this over the past few weeks, and they've long said that the official death toll in the U.S. and in many other countries around the world probably doesn't capture the full picture because people are dying at home and they're not being counted. What New York has done is now taken cases that are suspected, probable cases, but not confirmed, and added them to the death toll. So people who died at home or in a nursing home without officially being tested, that added 3,700 additional deaths to the state's tally. They have now had more than 10,000 fatalities in the state. And Anthony, just on a final note here, yesterday they had 778 more fatalities. They have reached a plateau, not a peak. In other words, it's not declining on the other side yet.
And a lot of other hotspots throughout the United States now emerging. Okay, we'll take a close look at that. Thank you so much, Jackson Prosco, joining us from Washington. All right, the Bank of Canada keeping its key interest rate at 0.25%, historic lows on that. This in an effort to combat the economic impacts of COVID-19, of course. The central bank says the downturn tied to this pandemic will be the worst on record. Preliminary data from Statistics Canada shows that economic activity collapsed in March as it dropped a record 9%. The Bank of Canada says the speed of the economic rebound will, of course, depend on how long the lockdown lasts. If conditions improve quickly, the economic shock will be deep but short-lived. And if you're just joining us, we're waiting for the Prime Minister to speak to the nation. He will take questions from reporters shortly after. This is a live shot of Rideau Cottage, his home in the nation's capital. Let's stay in Ottawa and bring in our Ottawa Bureau Chief, Mercedes Stephenson. My goodness, you hear those numbers, Mercedes, 9% reduction, the biggest on record. I mean, so many people are asking for help, desperate for help. We're now a month into this country. The numbers going forward are going to get even worse in all likelihood. So many people looking for help, as I mentioned, in particular, Canada's oil and gas sector. Can we see any help on the horizon?
Well, that's a great question, because if you remember a couple of weeks ago, Finance Minister Bill Morneau talked about help for the oil sector and said it was essentially mere hours away. Here we are a couple of weeks later and there still is nothing. And it's something that we've continued to ask the Prime Minister about as the price of oil has dropped. It's had a profound impact on Alberta, because you're talking there not only about a country, part of the country that was already devastated by what had happened with oil, but then those prices falling even lower on top of the loss of jobs that are not connected to oil and gas due to COVID-19, and also jobs connected to oil and gas that are lost due to COVID-19 and concerns there. So you're talking about a province that suddenly has seen its major source of income absolutely decimated. What we're trying to figure out is whether or not the government is going to bail out oil and gas, whether that will be part of a bigger package aimed at the energy industry or aimed at Alberta in particular. And we don't have much of a sense of that yet. The Prime Minister keeps saying that they know that there are many sectors that have been very hard hit and that they are going to do something for those sectors. But at this point, we still don't have a sense of when we might find out what the government is looking at doing and how they would do that. Would it be a regional aid package to the province? Would it potentially be money sent straight to oil and gas companies? Would they be looking at increasing something like liquidity? There's been some concern, I know, in the Premier's office in Alberta that foreign buyers could try to move in on Canadian oil and gas companies because they're vulnerable right now. And that could be a concern. You remember a few years back, there was an attempt to buy a major Canadian oil sands company, and the then Harper government blocked blocked that because they had national security concerns. So there's still a lot of questions about what's going to be done to prevent those companies from experiencing foreign takeovers, if that's a possibility, but also on just the human level. What's going to be done in a province where so many people have been struggling for so long, and they've now been hit with this double whammy of not only the oil price dropping, but also COVID-19, and then that's effect on the oil price, plus countries like Russia and Saudi Arabia, who started flooding the market to decrease the oil prices even further. And I'm hearing from folks who are out in Alberta, Anthony, who say they haven't had a job since the oil patch crashed. And now they're watching these programs go out, and they're sort of feeling very lost about what's in it for them, how they can apply, how they can receive some help. I spoke to one woman who is in her 80s. She emailed me, and her son hasn't had a job since the oil patch crashed. She's going through cancer surgery. She's trying to pay his bills and in part for some costs for his child. I mean, these are real people who are in a very difficult situation. So we're certainly anxious to hear whether the government is going to do something for that sector or not. It certainly sounds like they're looking at doing something. We just don't have a sense of what shape it's going to take, or frankly, how long it's going to take them.
Yeah, the more than 5 million people who have applied for the CERB and employment insurance over the past few weeks, I mean, is an indication of how desperate so many people are. And the question is whether more help will be forthcoming. We expect to hear something from the Prime Minister. We're given about a minute warning, give or take, so that could come any second. So forgive me if I have to jump in, Mercedes, but this is the nature of live television. Also gaining some attention is an open letter criticizing China, calling it China's Chernobyl moment. Say that 10 times. This was an open letter signed by many politicians, many policy experts, including, interestingly, Canada's former Justice Minister Irwin Cotler. Talk about that and really what this outlines, and whether there's more support from other Canadians, for example.
Yeah, so this is a letter that's been signed by over 100 experts and politicians and former politicians. Irwin Cotler is the former Liberal Justice Minister, so this is not a Conservative critic. This is another Liberal. He is renowned for his involvement in human rights, and he is not afraid to speak out against a lot of countries who he thinks violates them. And he's a member who signed this letter, and he is actually calling separately from the letter
we're going to have to pick up
style sanctions against
China. We'll pick up there in a moment. I'm going to have to jump in, as I predicted. The Prime Minister Justin Trudeau is speaking. Let's listen.
Some of the toughest jobs in the country. The women and men working in our hospitals, our seniors' homes, and our long-term care facilities are making sacrifices every day. If you do one of these jobs, thank you. Thank you for keeping us safe and healthy and protecting our loved ones. You deserve our full support. So if you need a hand getting through these tough times, we'll be there for you. Today, we're announcing more help for more Canadians. This includes topping up the pay of essential workers. At the same time, we'll also be expanding the Canada Emergency Response Benefit to reach people who are earning some income, as well as for seasonal workers who are facing no jobs, and for those who've run out of EI recently. And a little later, I'll have some news about where we are with testing. Au Parlement, vous m'avez entendu parler des contributions.
In Parliament, you've heard me talk about the contribution of the generation that grew up during the Great Depression and fought during World War II. Today, across the country, the last members of that generation are living in senior care homes, nursing homes, and the truth is extremely disturbing. It is that those very places where we look after our seniors are particularly vulnerable to COVID-19. That is a subject I will be tackling with the premiers during our discussion tomorrow evening. We must all do better. We must all demonstrate leadership to support the seniors who built this country. To begin with, our government will be working with the provinces and territories to increase the pay of essential workers earning less than $2,500 a year, like people in our long-term care homes.
Contributions of the greatest generation who grew up during the Depression and fought through the Second World War. Today, across the country, the last members of this generation live in nursing homes and long-term care facilities. The uncomfortable and tragic truth is that the very places that care for our elderly are the most vulnerable to COVID-19. I will be addressing this with premiers tomorrow night. We all need to do better. We all need to take leadership for the seniors who've built this country. Our government will work with the provinces and territories to boost wages for essential workers who are making under $2,500 a month, like those in our long-term care facilities. For many workers looking after the most vulnerable Canadians, including seniors and those with disabilities, we know conditions have gotten more difficult over the past weeks, and you need support right now. Tomorrow, in our weekly meeting, I will discuss with provincial and territorial leaders the importance of getting this wage boost in place as quickly as possible. As we face an unprecedented threat to public health, you are our most important line of defense. We will do whatever we can to help you do your job and support you through this time.
In March, our government established the Canadian Emergency Response Benefit, which is part of a plan we put in place to make sure that everyone had the help they needed to get through this difficult period. Millions of people have already received the CERB, but we know that a lot of people who didn't qualify for it still need help. So today we are going to loosen the eligibility criteria so that even more people can take advantage of the benefit, can be provided with a benefit. If you earn up to $1,000 per month, you can still apply for CERB because many people aren't getting the hours they were used to. Workers who have recently exhausted their employment insurance benefits will also qualify for CERB. Across the country, a lot of people will not have seasonal work this year because of the pandemic. They will also be able to apply to the CERB, which will be there for them. Things are also difficult for artists and creative people across the country. Cultural sites are closed. Work is very hard to obtain. Minister Guilbeault heard that artists were asking that a copyright for work completed before the crisis not be included in applications for the CERB. During these difficult times, it is artists who help us continue to dream and who put a bit of sunshine into our daily lives. We appreciate what they do.
We are expanding the Canada Emergency Response Benefit to include people making up to $1,000 a month, seasonal workers, and people whose EI has recently run out. Maybe you're a volunteer firefighter or a contractor who can pick up some shifts, or you have a part-time job in a grocery store. Even if you're still working or if you want to start working again, you probably need help in making ends meet. So if you earn $1,000 or less a month, you'll now be able to apply for the CERB. If you were expecting a seasonal job that isn't coming because of COVID-19, you'll now be able to apply. And if you've run out of EI since January 1st, you can now apply for the CERB as well. And for others who still need help, including post-secondary students and businesses worried about commercial rent, we'll have more to say to you very soon. No matter who you are or where you live, we're in your corner. After
having accepted a first request for assistance by Nunavik, the government of Quebec sent a second request for assistance on the lower North Shore. The Canadian Rangers will be going to lend a hand.
From the Canadian Armed Forces for Nunavik, the Government of Quebec has sent us a second request for Basse-Côte-Nord. I can confirm that the Canadian Rangers will be there to provide support. I want to thank our women and men in uniform and the families who serve alongside them for all that they do. Whenever we need you most, you're always there for us. Par moment, on peut se sentir.
Sometimes we could easily feel overwhelmed by what's happening. This situation seems surreal, and it's very difficult to deal with everything that's happening. This week, the government is launching a portal that brings together all mental health resources that are there for you. You can go to the site canada.ca or use the Canada COVID-19 application to speak to someone. There is no reason to feel ashamed.
If you're feeling overwhelmed,
when you need help, it will be there for you.
And there are people who can help. We have launched a mental health portal at canada.ca and through the Canada COVID-19 app, where you can go to find support. So if you need to, please reach out. We'll be there for each other. Finally, we have more news today to share on testing. Lumen Ultra from New Brunswick, with whom we signed a contract, is now ramping up production to supply enough COVID-19 test chemicals to meet the weekly demand in all provinces. And in the last few days, we received a new batch of swabs to make sure every province has the supplies they need to keep testing. Whether it's reagents or test kits, we are ensuring that Canada has the tools to fight this virus. Tomorrow, I'll also be speaking with the other G7 leaders about continuing to coordinate a strong and effective global response to this pandemic. L'entreprise Lumen Ultra du Nouveau-Brunswick est en train d'augmenter.
The New Brunswick Corporation Lumen Ultra is increasing its production so it can provide sufficient reagents to conduct the number of COVID-19 tests needed each week across the provinces. In the past few days, we've also received more swabs for the provinces. I know that everybody wants to know when life will get back to normal. But the truth is that we can't say. Not specifically, but here's what we do know. If this is to end, we need to stay home. We need to travel as little as possible. We need to keep a physical distance between ourselves and other people who don't live with us. And if we all do our share, we will get through this together. Thank you.
Thank you, Prime Minister. We'll now go to the phone for questions. There'll be one question and one follow-up. Operator.
Thank you. Merci. La première question, Michel Lamarche, TVA Nouvelle, à vous.
Mr. Trudeau, I'd like to hear you on the discussions with Quebec on the Canadian Armed Forces assistance for long-term care homes. Are members of the armed forces ready to be deployed to those long-term care homes? Talks with the provinces are ongoing, Quebec and the provinces, to see where we can help. There is a portal where people with medical experience or other specialized experience can offer their assistance. We have shared the portal with all the provinces. We are continuing to work directly with Quebec on their request for more resources, and we will continue working with Quebec. But you didn't answer the question. We know you're working on this, but Quebec said yesterday we need more people on the ground. In addition to military personnel, can you have the army help with serving meals, picking up waste? What can you do right now? What we're doing right now is speaking with Quebec to see how we can help. We recognize that Quebec has needs as most parts of the country do. And that's why we're working with the provinces to provide them, whenever we can, with the resources they need. We're there to be a partner and provide assistance as quickly as possible when it's required and necessary. Next question. Mélanie Marquis, La Presse. Mr. Trudeau. What do you think about Mr. Trump's decision to suspend funding to the WHO?
De faire tout ce qu'on peut pour protéger les Canadiens, pour assurer la santé et la sécurité des gens à travers le pays. Et ça implique travailler avec les experts ici au Canada et à travers le monde. Et on va continuer de faire ce travail important pour les Canadiens. Okay. One of the things that is so important for Canada to do is to continue to work with local experts and international experts to do everything we can to fight this virus and keep Canadians safe and protected. That's what we will continue to do.
Je veux bien, mais croyez-vous que ça aide?
Don't you fear consequences for the worldwide struggle against the pandemic? Well, tomorrow we'll have a chance to have a discussion with the other G7 leaders for the purpose of having the best possible coordination in order to check COVID-19, and also to have science-based efforts and based on the advice coming from experts, worldwide experts.
Thank you. Merci. The next question, Justin Ling, freelance. Please go ahead.
Hi there, Prime Minister. Obviously, I've been asking you for about a month now about the state of Canada's prisons. You've promised repeatedly that new measures would be coming, that the Minister of Public Safety would be announcing new cooperation with the Parole Board. We still haven't seen any of that. So is this just not a priority? Is nothing coming? Is there even going to be a decision about those inmates who are being released on day passes, like other provinces have done, to release them temporarily? Is there any announcement coming?
We have made significant efforts and taken significant steps to ensure that our incarcerated population is kept as safe as possible from COVID-19. There are a number of measures that we've taken. We continue to look at more measures. We're coordinating with the provinces on these efforts as well. We know that this is an area where we've seen challenges in terms of outbreaks, but we also are continuing to step up our efforts every day to ensure that all Canadians are protected.
So you're stepping up your efforts. The directive from the Commissioner last week said that corrections officers should wear face masks. The Corrections Canada has previously said they're providing soap and hand sanitizer. By all accounts, those things aren't happening. So if the work you're doing isn't happening, do you need to change tack? And finally, have you totally abandoned the idea of releasing federal inmates?
There have been a number of discussions at the highest levels about various processes that need to be put in place. There have been a reduction in transfers, in issues that have put potentially people who work there and people who are incarcerated there more at risk. We have taken a number of measures. We will continue to look at taking more measures, and we will ensure that the measures in place are properly followed. We
recognize the importance of protecting people who work in our federal institutions and as well as the inmates. So we will continue to make sure that these measures are implemented, and we will be looking for new innovative ways of guaranteeing the people's security.
Canadian Press. Please go ahead.
Good morning, Prime Minister. Social distancing advice differs from jurisdiction to jurisdiction, from Vancouver closing Stanley Park to cars, so more people can walk around it, to Ottawa's local experts telling people to basically not chat on their driveways with neighbors. In light of this, how do you sustain public confidence in social distancing measures?
I think we've been very, very clear that the best way to prevent further spread of COVID-19 is to stay home as much as possible. If you have to go out infrequently and keep 2 meters distance from each other and wash your hands aggressively and often. These are the things that we're asking all Canadians to do. Across the country, we recognize that different communities are in different situations, that there are different local health experts giving advice that is suitable to that particular context. We make sure that everyone is getting the message that we all have to do our part to fight COVID-19, and that means engaging in social distancing, but it is perfectly normal that there be slight variances in approaches in a pandemic that is manifesting itself in very different ways in different parts of the country. Okay. Nous soulignons à quel point c'est important.
We want to emphasize how important it is to take measures for the purpose of preventing this further spreading of COVID-19. So let's not go out of our homes unless it is absolutely necessary. And if we do so, let's keep our physical and social distancing, and let's wash our hands often and very, very thoroughly. Obviously, the situation isn't the same from one region of the country to another, so local experts will give varying directives to the local population. But the main purpose is to keep our implementing a social distancing and also check the spread of COVID-19. S'agissant de l'Organisation mondiale de la santé, alors, quel est l'appui financier qu'apporte le Canada à l'OMS? Est-ce que le président américain a essayé de faire pression sur le Canada pour qu'on suive l'exemple des États-Unis? L'appui du Canada pour l'OMS se compte en dizaines de millions de dollars et nous l'avons récemment augmenté. Je vais vérifier les chiffres et nous...
For you or for the media. No, the President hasn't made any direct asks or indirect asks of Canada around that.
Français.
Okay. Je crois que on appuie...
I believe that we provide tens of millions of dollars to the WHO, and we have recently increased our contribution relative to this pandemic, but I will make sure that the exact figure is provided to you within the next hours. And the answer is no, there was no pressure exerted by the U.S. President on Canada regarding the WHO.
Glenn McGregor, CTV News. Prime Minister, you've repeatedly said how much Canada has relied on WHO for information about what's happening around the world. Are you satisfied the organization sufficiently interrogated the information coming out of China in the early days of the pandemic? We know now a lot of the information was either false or misleading, especially about human-to-human transmission. Do you think they did a good job on how they handled that information and shared it with other countries?
I think what we need to remember is the path through this pandemic is for us to base ourselves on science, on the recommendations of experts, on the data and the knowledge that we've gathered from past pandemics and past health issues to apply to these situations. And that's why we will always continue to work with experts, both domestically and internationally, to take the best advice possible in keeping Canadians safe. Of course, in the coming months and years, there will be many reflections on various institutions and systems, both domestically and internationally, on how we can improve our response, how we can learn from things we could have done better in this process. These are things that will come in the coming times. Right now, our focus needs to be on doing the best we can right now to protect Canadians.
We're hearing about potential shortages of medication used for painkilling and sedation before patients are intubated and put on ventilators. What's happening at the federal level to ensure that there's a continued supply of those medications?
Public Health Canada and Procurement Canada are working together to ensure the steady supply of essential medications to Canada, both related to COVID-19 and not. We recognize that this is a global health crisis, so there are challenges, but Canada has a very strong pharmaceutical industry. We have very strong relationships around the world on getting medication and necessary supplies, and we will continue to do everything we can to ensure that Canadians get what they need. Nous avons nos équipes et nos ministères en train de travailler avec.
Our teams and our departments do cooperate with our provincial partners, our partners throughout the world, for the purpose of guaranteeing the supply of all the materials and items that we need for the purpose of fighting COVID-19. And we'll keep doing whatever we can for the purpose of securing the supply of those items for Canada. And Canada should always have the necessary equipment and items.
On that WHO, you were just asked this, but the Conservatives and others have raised concerns that the WHO was too willing to take the word of the Chinese regime early on in the pandemic. Do you share those concerns?
I think there's obviously reflections that we have to have going forward, and we have to make sure that we are doing everything we can to keep Canadians safe. And that is our focus right now. What can we do now? What do we need to do in the coming weeks? How do we lean on experts in international institutions and in partner countries around the world? We're making recommendations alongside our domestic experts on what we need to do now. There will be plenty of time as we move forward to reflect on challenges that were faced in the past. We need to learn and move forward as quickly as we can.
And you said yesterday that you're talking to the provinces and territories about eventually reopening the economy. Can you say what work specifically you're doing with the provinces and territories to do this? And you also said that there are different points along the spectrum of the pandemic. So do you see when things do start returning to normal, is that going to be on a provincial level, a local level, a national level? How's it going to work?
Well, we recognize that this pandemic is going through very different phases at different points, different places across the country. One size fits all will not work for a country as diverse as Canada, but the overarching principles are extremely important. We know, regardless of where you are in the country, we need to get through this first wave before we can start releasing some of the rules around social distancing and staying at home. How that release works will vary from region to region, from industry to industry, and coordination at the federal level on how we do that is going to be very important. But with spring coming, people are looking outside, wanting to get out, wanting this to be over. I understand that. It will be weeks more before we can seriously consider loosening the restrictions. It would be terrible if we were to release restrictions too early and find out that we're suddenly back in another big wave of COVID-19 and everything we've gone through up to now would have been for nothing, because we'll find ourselves once again in the same situation. If we hold on through this period now, as long as we have to, once we are able to release things, we will be able to better control how things move forward. But as impatient as people are getting all across the country, we need to continue to hold on if what we're doing now as sacrifices are going to be worth it. Okay. I
do recognize how impatient people are getting and want to know when we'll be able to soften the rules in terms of social distancing and also help the recovery of our economy. However, if we lower our guard too early, we might be confronted with another wave which would have even more terrible, even more devastating consequences. So people are now sacrificing, they're now accepting measures which are difficult to implement. Well, let me tell you, this will be on for another number of weeks if we want to be able to correctly manage the situation and have a gradual exit from the crisis. Of course, we'll have to coordinate with the provinces, but mostly we'll have to try and remain within this phase and its constraints in order to make sure that when we release the constraints, we will not find ourselves starting from scratch with COVID-19 attacking us.
But just to follow up on that, I'm wondering whether you envision when that happens that workers will be tested before they return to work.
Obviously, when we are able to loosen the controls on social distancing and start to reopen our economy, massive, rapid testing on a very wide-scale basis will be an essential part of the vigilance we have to have. There will also be a need for very aggressive contact tracing whenever there is a case that appears. We are going to have to be extremely quick about responding to any future outbreaks in future waves. But in order to get to that point, we need to continue doing what we are doing now for many more weeks. We cannot be in a rush to get things going again, because if we move too quickly to loosen all these controls, everything we're doing now might have been for nothing. We'll find ourselves in another peak just as bad as this one or worse, and it will be extremely damaging both to how Canadians feel, but also to our economy. That's why we are going to be extremely careful about any steps towards reopening the economy. It seems like over the past days, people are talking about, oh, when we reopen this, we'll do this, we'll reopen that. It's not happening yet. If we reopen too soon, everything we're doing now might be for nothing. We are making sacrifices. We're there for each other. We need to hold on still. And then, once we're ready, once we feel we're through, once the experts are telling us that we can talk about reopening the economy a little bit, we will take very careful steps and do that. Okay.
Yes, I do recognize that for the last few days, many people have been talking about reopening the economy. They've been talking about economic recovery and resuming their activities. Of course, this is springtime and people want to go out and they are very impatient, but we are far from this, let me tell you. Because should we reopen prematurely our activities, we might find ourselves in a situation much worse than the one we've been through. And we would be cancelling all the efforts and all the results of all the efforts that we have been accepting. So we do not want this to occur. And so let's continue implementing this wonderful, resilient discipline that we Canadians are demonstrating, and let's do all we can, to protect our seniors, our vulnerable people. So let's keep doing it.
Across the country, with regards to long-term care facilities, people getting sick, people being abandoned, many dying. If your mom was in one of these facilities, what would you do?
I can't imagine what so many Canadians are going through right now with loved ones who are suffering, people they can't even visit right now, seniors worried about falling ill and not being able to see their kids and grandkids again. These are the things that we need to focus on as a country. That is what I will be speaking with premiers about tomorrow night, how the federal government can support the premiers in their responsibility in their jurisdiction over long-term care facilities and senior care, to make sure that we are supporting the heroes who are working in extraordinarily difficult situations for very low pay, to continue that work safely and mostly to keep our elders safe. This is a situation where, as a society, as a country, we need to pull together to be there for our elders who built this country. That's what we're going to focus on in the coming days. Nous reconnaissons à quel point c'est essentiel.
We do recognize and acknowledge how essential it is to do our best for our seniors, and also in order to help the people who heroically work in those long-term homes with very, very low salaries. This is why tomorrow I'll be talking to my provincial counterparts for the purpose of guaranteing the security and the health of our elders and the people who work and help them. At the moment, they're being confronted with uncertainty, anxiety, fear. They would like to see their children and grandchildren, so we do much better for them. Regarding the long-term care homes, the Canadian Armed Forces might possibly intervene. So will you be sending only medical military staff, or will you send other specialties of our armed forces for the purpose of helping the people and the staff, which is overwhelmed and underpaid? Well, we're doing our best for the purpose of determining how we can send more resources. And we had 2 specific requests from Quebec in order to send the armed forces to Nunavut and to the Basse-Côte-Nord. So we will continue working with the province, and we will continue to meet their requests in every possible field of endeavor as they see fit.
There have been 2 requests so far by Quebec to send in support from the Canadian Armed Forces in both Nunavut, in northern Quebec, and in Basse-Côte-Nord. These are things that we are doing. As any more requests come in, we will look to support Quebec or other provinces who are asking for help from the federal government, regardless of what that help looks like and what they're asking us. We will be there to help out as provinces need help.
Regarding the pandemic as such, you say we have to continue implementing the necessary directives for the purpose of stopping the pandemic. But there will be no stopping of the pandemic for the next few months at least, because there's no vaccine. So do you have some draft plans for the purpose of protecting some people, as some other countries do? Answer. Our main concern would be to have our health services overwhelmed by the situation, and we might then move from 2 to 3% mortality rate to much more. And this is what we're setting up. We're setting up various approaches based on technology, based on screening, and based on tracking contacts. So we are at the moment developing and improving the tools we need for that purpose. And once we have been through the first wave of COVID-19, we might be able to perhaps slightly loosen controls on the economy and on our population. But as long as we do not have vaccines, we will still have to remain extremely vigilant, and we will have to react quickly should there be a new wave of COVID-19. And so we are developing those plans. In the meantime, let me repeat that we will have to continue implementing severely and stringently all the restrictions which have been put into place for the purpose of slowing down the spread and look at the future and the next steps.
We know that until there is a vaccine for COVID-19, we are going to have to remain extremely vigilant as a world, as a country, to resurgences, even once this first wave is through. Once we see this first wave pass through Canada, without having overwhelmed our healthcare system and our healthcare workers, as we certainly hope. We will be able to look very carefully at how, with extraordinary vigilance and very rapid response times to any future resurgences of the virus, we can carefully re-engage in certain sectors of our economy in loosening up the restrictions. But we are not there yet. We have to be through this first wave sufficiently to be able to know that we have the capacity to stamp out and restrict any future outbreaks as they come along. That means technology, that means better testing capacities, that means continued vigilance, not just by governments, but by all Canadians to preventing it. We're still a number of weeks away from that, but we are reflecting on what that looks like and what sort of technology and medical solutions will be necessary. We will get through this together, but for now, we need to stay strong in our social distancing measures and by staying at home. Merci beaucoup tout le monde.
And that wraps up Prime Minister Justin Trudeau's address to the nation. He was quite firm at one point, perhaps the most firm we've seen in a while when it comes to we are weeks away from easing any restrictions. So, of course, we are all hunkering down. Let's bring in Michael Couture in Ottawa. So a lot there, of course, and some changes to the CERB, it seems. The umbrella shielding Canadians from this storm is getting bigger. Highlight some of the details on that, Mike.
Essentially opening it up to more people. And the NDP had contacted me as well saying, hey, don't forget this is something that we put on the table and that we are taking a bit of a victory lap on this one. Seems like it's a Team Canada approach here as well. So anybody who earns about $1,000 or less per month will be able to apply for this. So a seasonal worker who expected to be working in the next few months, or if you applied for EI at the beginning of January or in January, and that has since run out, you can now go on CERB. And let's not forget how much that is. That is $500 a week for up to 16 weeks. I wanted to also note for you, Anthony, as you mentioned, firm today. It almost sounds like the Prime Minister is getting sick and tired of answering these questions about when the economy will reopen and saying, look, if we don't continue to do these measures, then we can't reopen it. And it's sort of a can of worms that's been opened by politicians who are talking about trying to give a bit of a ray of hope to people and the light at the end of the tunnel that eventually we'll get there. Trying to be firm today. It's weeks, folks, and it'll be minimal when it does happen.
Yeah, in many ways a reference to Saskatchewan Premier Scott Moe, who says he will outline Saskatchewan's plan next week in terms of when they will or could at least reopen the economy. Mike, we'll have to leave it there. Thank you so much. Let's stay in Ottawa and bring in our Ottawa Bureau Chief, Mercedes Stevenson. Look, Mercedes, a lot that he discussed. He was asked about the China question in many ways. We heard Andrew Scheer, the opposition leader, sort of adding to the chorus of criticism towards WHO, towards China. The Prime Minister, is it fair to say, sort of danced around that and indicative in many ways of the political dance between Canada and China, given so many other diplomatic issues going on?
Yeah, he's been asked this question a number of times, and every time he sort of indicates, without saying China, that there are countries that they'll reflect upon their performance in the international community will do so, but basically says that's not what he wants to do right now. That doesn't answer the question about whether or not he thinks that they were not on with the WHO, as U.S. intelligence and some Canadian intelligence has indicated, whether they downplayed the scale of that. One thing that I've heard from some people in the national security community is that there could be some concern that as they are trying to get critical personal protective equipment as well as pharmaceuticals from China, it's not perhaps the time that they want to start a bigger fight with China right now. But I think there's a lot of long-term questions here about what China reported to the WHO, whether or not Canada took those numbers at their word and trusted China. Something we asked federal ministers several times, do you trust the Chinese numbers? The health minister said yes. Minister of Foreign Affairs was a little more circumspect. So certainly a big question, Anthony.
And also, Quebec requested additional help from the Canadian Armed Forces. What do we know on that?
So they've asked for additional help for another remote community up north. This will be the Canadian Rangers. You'd recognize them by their distinctive red sweatshirts that they wear. They are largely Indigenous Canadians who engage in that, and they'll be involved in supporting that community through example, helping with things like logistics, getting people lined up to go into clinics, setting up tents, likely if it looks like the other scenario where they're involved right now, but we don't have a lot of details on that just yet.
Ladies, we'll have to leave it there. We always appreciate your insight. Thank you so much. So if you are just joining us at home, here's what we heard today from the Prime Minister. He announced changes to the CERB to help more Canadians. It now includes anyone who has run out of EI, seasonal workers, frontline workers who are working fewer hours as well. If you are earning less than $1,000 a month, you can now apply for the emergency response benefit. The Trudeau government will do whatever it can, it says, to support workers in long-term care facilities, and also discussed a wage boost, and he will discuss that with premiers tomorrow. We're still waiting to hear about help for small businesses trying to pay rent, for example, and what is being done to help post-secondary students. A lot more to come on that. We're waiting for that. In the meantime, I'm Anthony Robart. Thank you so much for joining us. We'll have full updates on globalnews.ca. Thank you for watching.
Bonjour et merci de vous être joint à nous aujourd'hui.
Hello, and thank you for joining us
We
today.
all know that our fight against the coronavirus is exacting a high economic and human price. We know that many Canadians are struggling to make ends meet. That is why today the Prime Minister announced that we're expanding our support for the Canadians who need it most. My colleague, Carla Qualtrough, will elaborate on this in a moment. Je sais qu'aujourd'hui, les Canadiens ont de la difficulté à joindre les deux
Today,
bouts.
Canadians
C'est
are
pourquoi
struggling
je
to
suis
make ends
heureuse de
meet.
pouvoir dire que
That's
nous
why
assouplissons
I'm
les critères
happy to
d'admissibilité
announce
pour
that
la
we
PCE.
are expanding
Les Canadiens et Canadiennes
eligibility
sont
criteria
résilients.
to the
Nous
CERB.
allons passer à
Canadians
travers
are
ensemble.
all very resilient, and we
So
will
today
get through
we
this
are going
together.
to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, Canada's Deputy Chief Public Health Officer, le Dr. Howard New, our Minister of Health, Patty Hajdu, by video link, our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, et bien sûr, le président du Conseil du
And
Trésor,
we will
Jean-Yves
hear from the
Duclos.
President of the Treasury Board, Jean-Yves Duclos.
Hello everyone, bonjour à toutes et à tous.
Hello, everyone.
I'll start as usual with our update on the number of COVID-19 cases in Canada. There are now 27,557 cases, including 954 deaths. These numbers change again throughout the day. For the lab testing, we've completed tests for over 462,000 people, with about 6% confirmed positive, as Canada continues to improve our testing to better track where the disease is spreading. As Canadians continue to practice physical distancing, we are closely monitoring for signs that our efforts are having an impact on the epidemic curve. It's taken just over 3 months for the first cluster of COVID-19 cases in China to spread globally and establish the pandemic. It is hard to take in how our lives have changed in such fundamental ways over this short period. At this point, we still don't have all the answers, but there is some cause for cautious optimism coming from our epidemiological data. Because COVID-19 is very contagious, even a few cases can quickly multiply, resulting in a steeply rising epidemic curve. This type of increase is referred to as exponential growth, with case numbers doubling every few days. In late March, when the growth rate was the fastest, we saw case numbers doubling every 3 days. But in recent days, we've observed a doubling time of over 10 days. This means the epidemic is slowing down. Though we all wish this could be a sprint to the finish, it is not. This will be a marathon, and there are no rewards for quitting early. To use another analogy, coming down from this epidemic curve will be like making our way down a mountain in the darkness. We mustn't rush or let go of our safety measures, or the fall will be hard and unforgiving. We need to remind ourselves that this is an emerging disease, and that we don't know everything, so the terrain will be uncertain. That means we need to go slowly and be sure of our footing before taking each new step on the way down. Along the way, We'll need to closely monitor cases and growth trends to ensure we've got the right public health measures in place to detect and quickly respond to any new cases or clusters. We'll also need to maintain physical distancing during this time. Any break in our resolve could spark a new outbreak and delay our progress. So let's maintain our collective resolve and crush this curve. Thank you.
Thank you very much, Dr. Tam. Maintenant, je donne la parole à Dr. New. Dr. New, s'il vous plaît.
And now, Dr. New. Go ahead,
Merci.
Dr. New.
Bonjour.
Thank you.
Commençons
Hello,
par
everyone.
le compte habituel des cas de COVID-19
I'll
au
begin
Canada.
with our usual
Il y a
update on the number of
maintenant
COVID-19 cases in Canada. There are now 27,557 cases of COVID-19 in Canada, including
Ces chiffres changent tout au
954
long de la
deaths.
journée.
These numbers
Nous avons
change
mené
throughout the
des
day.
tests sur plus de
As for lab testing,
462 000
we've completed tests
dont
for over
environ 6% ont été
462,000
déclarés
people,
positifs.
about
Le
6% of
Canada
whom
continue
have been
d'améliorer les
confirmed
tests pour mieux
positive.
suivre la
Canada
propagation
continues to
de la
improve
maladie.
testing to better track where the
Pendant que les
disease is
Canadiens
spreading.
continuent de pratiquer
As
l'éloignement
Canadians continue
physique,
to practice
nous
physical
surveillons de près les
distancing,
signes
we
que
are
nos efforts
closely
ont une
monitoring for
incidence
signs
sur
that
la
our
courbe de
efforts are having
l'épidémie.
an impact
Il a
on the
fallu
epidemic
qu'un
curve.
peu plus de 3 mois à la
In
première
just over
greffe de
3
cas de
months, the
COVID-19 en
first
Chine
cluster
pour
of
se propager
COVID-19
partout
cases
dans le
in
monde
China
et créer
spread
la
globally
pandémie.
and
Il n'est pas
established the
facile
pandemic.
d'accepter le fait que nos vies ont
It
changé
is
de manière
difficult to take
aussi
in how our
fondamentale
lives
sur
have
cette
changed
courte
in such
période.
fundamental ways
À ce
in such a
moment-ci,
short
nous
time.
n'avons pas encore toutes
At
les
this point,
réponses, mais les
we
données
don't yet have all the
épidémiologiques nous
answers,
inspirent un
but there is
optimisme
some cause
prudent.
for cautious
Comme le
optimism coming
COVID-19
from
est
our
très contagieuse,
epidemiological data.
même un tout petit nombre de
Because
cas peuvent se
COVID-19 is
multiplier
very contagious,
rapidement,
even a few
provoquant
cases can
ainsi une
quickly
montée en
multiply,
flèche de la courbe
resulting in a
épidémique.
steeply rising
Ce
epidemic
type
curve.
d'augmentation se nomme
This
une
type of
croissance
increase is referred
exponentielle
to as
et signifie
exponential
que le
growth.
nombre de cas double
This
tous les
means
2 ou
that
3
case
jours.
numbers can
Fin
double
mars,
every 2 or 3
au moment
days.
où le taux de croissance
In
était le
late
plus
March,
rapide,
when the
nous avons
growth
vu,
rate
nous
was the
avons vu
fastest,
le nombre de
we saw
cas
case
doubler
numbers
tous les
doubling
3 jours.
every 3 days.
Par contre, ces derniers temps,
In
un
recent
doublement
days,
de plus
however,
de 9 à 10
we've
jours
observed
a
a
été
doubling
observé.
time of
En
about
d'autres
9
mots,
or 10 days.
l'épidémie
In other
ralentit.
words, this means that the
Certes, nous
epidemic is
aimerions
slowing down.
tous être rendus au sprint vers la ligne d'arrivée,
Though we all
mais
wish
ce
this
n'est
could
pas
be
le
a
cas.
sprint to the finish line,
Nous sommes en train
it
de
is
faire
not.
un marathon et nous
This
ne
will be a
serons pas
marathon.
récompensés si nous
There are
arrêtons
no
prématurément.
rewards for quitting
Pour
early.
utiliser une autre analogie,
I'd
sortir
like
de
to use
cette courbe
another
épidémique
analogy.
sera comme une descente
Coming down
d'une
from this
montagne dans
epidemic curve will be
l'obscurité.
like making our way down
Nous
a
ne devons
mountain
pas
in
nous
the darkness.
précipiter ou
We
abandonner nos
must
mesures
not
de
rush or let
sécurité.
go of our safety
Sinon,
measures.
la chute
If
sera
we do,
brutale
the
et
fall will be
terrible.
hard and
Nous ne devons pas
unforgiving.
oublier qu'il s'agit d'une
We
maladie
need to remind
émergente
ourselves that
dont
this is an
nous ne savons
emerging
pas encore
disease.
tout. Ce qui
We
fait le
don't
terrain
know
sera
everything,
hasardeux.
which means that the
Cela
terrain will
signifie
be
que nous
dangerous
devons
and
y aller
uncertain.
lentement et nous
That
assurer de
means that
prendre
we
un
need to
bon
go
appui
about
avant
this
de faire
slowly
chaque
and
nouveau
be
pas
sure of our
dans la
footing
descente.
before taking each
En
new
cours de
step on
route,
the way
nous
down
devrons
and
suivre
out.
de près les cas
Along
et
the
les
way,
tendances de
we will
croissance
need to
pour nous
closely monitor
assurer que
cases
nous avons
and
mis en
growth
place
trends to
les
ensure
bonnes
we've
mesures
got
de
the right
santé
public
publique
health measures
afin
in
de
place
détecter
to
tout
detect
nouveau cas
and
ou groupe
quickly
de cas
respond
et
to
y
any new
réagir
cases or
rapidement.
clusters
Nous
and to
devrons aussi
react
maintenir
quickly.
l'éloignement physique
We'll
pendant
also
cette
need to
période.
maintain physical
Tout
distancing during
fléchissement
this
de
time.
notre détermination
Any break
pourrait
in our
déclencher une
resolve
nouvelle
could spark a
éclosion
new
et
outbreak
freiner
and
notre
delay our
progrès.
progress.
Alors,
So,
maintenant, notre volonté collective
let's maintain
et
our
écrasons
collective
cette
resolve.
courbe.
Let's
Merci.
crush this curve. Thank
Merci,
you.
Dr. Knu.
Thank you,
And
Dr.
now,
New.
Minister Hajdu. Patty, please.
Thank you, Deputy Prime Minister. Bonjour à tous. J'aimerais
Hello,
vous parler
everyone.
aujourd'hui de santé mentale.
Today, I'd like to talk
Ça
to you about
peut
mental
être
health.
difficile de garder une bonne santé
It can
mentale
be
avec toute la
difficult to
perturbation qui se
maintain
passe actuellement.
good mental health
Ce n'est
with
pas
all
facile
the
de
disruptions
garder
we're
une
currently
routine.
experiencing.
La
It can be
semaine
difficult to
dernière, nous avons
maintain
parlé de
routines.
modélisation
Last
d'un
week, we
exercice
talked
choc
about
pour certains.
modeling. It was a very
Nous avons
shocking exercise for some.
comment le virus pourrait continuer
We
à se
heard how
propager
the
au
virus
pays
could continue to spread in Canada if we don't all continue to follow public health advice.
Living through a pandemic is not easy. Many people are struggling with fear, anxiety, and loneliness. And not being able to use our regular support networks or even practice our regular routines all across Canada means people are struggling. And they need tools to help, including with their mental wellness and health. So as of today, all Canadians have improved access to mental health supports through an online resource called Wellness Together Canada. You can check out this new suite of tools at canada.ca/coronavirus and through the Canada COVID-19 app. This resource has different tools available to meet the variety of Canadian needs. Whether it is anxiety, sadness, or substance use, there is something there for you. The options include an online peer community to talk and share and support others. There are also a number of self-help resources to help with anxiety, stress, or other issues. And there are options such as texting, calling, or connecting by video for a session with a professional to address a specific need. I encourage all Canadians to explore Wellness Together Canada, to use its resources, and to reach out virtually to loved ones. Now, more than ever, we need to stay connected. Thank you.
Okay, thank you very much, Patty. And now we will hear from our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, joining us over video link. Carla, please.
Thank you, Deputy Prime Minister. Hello, bonjour. Comme je l'ai dit depuis le début,
as I said since the beginning, we have been committed to supporting all workers impacted by COVID-19. That is why we introduced the Canada Emergency Response Benefit.
We recognize that under the current design, some workers don't qualify for the CERB, but are still in need of financial assistance, which is why we're expanding the eligibility criteria for this benefit so that it's more inclusive. As announced by the Prime Minister this morning, we are expanding the eligibility of the CERB to allow workers, including self-employed, to earn up to $1,000 per month while still collecting the CERB, to include workers who recently exhausted their EI benefits and are unable to find a job because of COVID-19, and to include seasonal workers who have exhausted their EI benefits and are unable to undertake their usual seasonal work as a result of the COVID-19 outbreak. Ces changements témoignent des différentes réalités auxquelles font face les travailleurs canadiens à l'heure actuelle. Nous savons que les gens souhaitent demeurer sur le marché du travail, mais on voit une baisse considérable du nombre d'heures travaillées et des pertes de revenus à cause de la COVID-19. The changes announced today will increase the number of workers we can help, including those who still have some income but not enough now to make ends meet. The CERB will give them the extra support they need. We also know that Canadians, including many seasonal workers who have been collecting EI, may not have jobs to return to and are anxious as their EI benefits have either already run out or will run out soon. These people also need our support and will now be eligible for the CERB. We also want to ensure that our essential workers are supported during this critical time. They are working day in and day out at our hospitals, assisted living care facilities, senior and long-term care homes, and we know the sacrifices you're making to keep us and our loved ones safe. That's why the Prime Minister also announced that he and Minister Marneau are working with the provinces to provide a temporary top-up to salaries for essential workers making less than $2,500 a month. Nous savons qu'il s'agit d'un moment difficile pour beaucoup d'entre nous.
We know that this is a stressful time
à
for
chercher des
many.
manières de faire en
We will
sorte
continue
d'aider
to
tous
look
les
for ways
Canadiens
to
pendant
ensure
cette
that we
période
help all
difficile.
Canadians during this difficult
Je
time.
serai heureuse de répondre à vos questions. Merci,
And
thank
I'd
you.
be happy to take your questions.
Okay,
Thank you.
very much, Carla. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
And now we will
Merci
hear from
beaucoup,
the President
Christian.
of the
Bonjour
Treasury
tout le monde.
Board, Jean-Yves
Hello,
Duclos.
everyone.
Thank you
Alors,
very
ce
much,
matin, nous
Christian.
avons eu une importante annonce
Hello,
de la
everyone.
part du Premier ministre que
This morning,
Carla,
the Prime
la
Minister
ministre
made an
Qualtrough, a
important
très bien
announcement.
résumé. Une annonce qui
Minister
met un peu les
Qualtrough
choses en
just summarized it
perspective.
for
Nous
us
vivons
very
depuis
well.
quelques semaines une
Today's
urgence
announcements
à la
really
fois sanitaire et
puts
économique
things into perspective.
considérable qui a amené le
The
gouvernement canadien à faire
economy
des
has
choses qu'il n'a jamais
been
fait dans son
significantly
histoire.
disturbed,
Et
which
ça
has led the
implique
government
à
to
la
take
fois d'élargir
unprecedented
et de
economic
resserrer
action
le
and pass
filet social
unprecedented
que l'on a
measures.
connu depuis
We
la
have
Deuxième Guerre
had to
mondiale.
strengthen
Et
our
ça
social
implique,
safety
entre
net.
autres choses, d'ajuster
This is the most
un élément
substantial economic
majeur de
action
ce
since the
nouveau
Second
filet
World
social
War.
temporaire du
And
gouvernement
today,
canadien qui est la
we
prestation
are
canadienne d'urgence. Donc,
expanding
des gens qui
one
autrement
part
n'auraient
of
pas
the
eu
government's
droit à la
three-part
prestation
economic
canadienne
action
d'urgence de
plan,
$2,000 par mois.
the
Ça,
Canada
maintenant,
Emergency
avec l'annonce
Response
du Premier ministre
Benefit.
Trudeau,
So
qu'ils
now
y
those who
auront
are
droit,
earning
ça
$1,000
inclut,
or
entre
less,
autres, ceux
they have
qui ont
heard today
perdu
from the Prime Minister that they
une
will
bonne
now
part de leur
be
capacité de
eligible for the
générer et
CERB.
obtenir des revenus, mais qui
And
continuent
those
à avoir
who
des
have
petits contrats. Ce
lost
sont
their
beaucoup
income
des
or
travailleurs
lost
autonomes.
most of their
Ça peut être
income.
des artistes
For
qui
example,
continuent
artists,
à avoir
the
un peu de
self-employed,
revenus, mais
freelancers.
qui ont beaucoup de difficultés à
Today
joindre les
we
deux
are
bouts. Des
helping
gens
those
qui
who are
ont
still
perdu leur
making
travail,
some
mais qui ont
income,
des
but are
revenus
having difficulty
partiels en
making
raison de
ends
temps
meet.
partiel. Ça peut
Their
être des élus
income
municipaux
is
ou des
much
pompiers
much decreased. This can include volunteer firefighters who are also working reduced hours. Today, our announcement is very important. All of these individuals I just listed, all of these groups will now have access to the CERB, backdated to March 15th. And for those who were worried about juggling taking care of their health and their families, for example, seasonal workers, and also those who have lost their jobs in the past few months, and those who have lost their EI, employment insurance benefits, since the 1st of January, they will also be eligible for the Canada Emergency Response Benefit, or CERB.
Importante pour ceux qui travaillent dans les services essentiels au Canada et au Québec en particulier.
Our thoughts are with essential workers in Quebec and in Canada. Our thoughts are with those who are caring for our seniors. They're working in very difficult circumstances and may be earning less than $2,500 a month. Prime Minister Trudeau made another announcement this morning. He announced that we will be helping these people. They will receive a temporary salary top-up so that they can continue to do the essential work that we need in our society, taking care of seniors and others in need of care. Thank you. Christia? Thank you very much, Jean-Yves. And now we're ready to take questions. Thank you, Deputy Prime Minister. We'll start with 3 questions over the phone line.
And then turn to the room. 1 question, 1 follow-up. Operator?
Merci. Thank you. Please press star 1 at this time if you have a question. Appuyez sur l'étoile maintenant si vous avez une question. Notre première question nous vient de Marie Vastel du Devoir. À vous la parole, please go ahead.
The first question is from Marie Vastel, Le Devoir. Question. Hello, Minister Duclos. I have a question about the CERB and about today's announcements. Here's my first question. What will be the total bill for the CERB? How much will it cost the federal government, especially given these new expansions? And how many additional Canadians do you think will be eligible after today's announcement? Answer, Minister Duclos. Thank you very much for your questions. Ministers Qualtrough and Morneau will have more information in the upcoming days. Here's what's essential. We are making sure that no one falls through the cracks. We want our social safety net to help as many people as possible. That's why we're expanding the CERB. Quebec has announced measures to help its workers in care homes, and we are following suit. Seasonal workers are also extremely important in Canada, in the East, in Quebec. Seasonal workers at this point in time would normally have seasonal work, but that won't be the case this year. We're also trying to help workers who have lost almost all of their contracts. We're trying to help self-employed workers and those who have seen their income drastically cut. Workers will still be able to have a few contracts, all while being eligible for the CERB.
Mr. Qualtrough can answer my first question then, and then I'll ask my follow-up at the same time. So my first question was, what is the total bill that you estimate the new CERB will cost, given that it's been expanded to include more workers? How much now do you estimate it will cost? How many more people do you estimate will qualify for the CERB now with those changes that you've announced today? My follow-up then is concerning the hiking of the salaries for essential workers. Can you clarify which essential workers you are looking at? Is it just for long-term residences, or is it other sectors? Is it only health sector? Can you clarify? And will Quebec also get money from that top-up, given that they've already started topping up their own essential workers' salaries?
Well, thank you for those questions. First of all, with respect to the number of workers and the costs, that will, it's a little premature to estimate based on the fact that we don't know the uptake yet of the wage subsidy. We really want employers to hire people back. We want people to switch back from the CERB to the wage subsidy. So right now we're estimating that while the expanded eligibility criteria will indeed allow more people to access the CERB, there will be less people on the CERB once the wage subsidy is fully implemented, because ultimately we want people to go back to their work, to their jobs, and be connected into the labor market as we transition out of this. In terms of the essential workers piece, I'll defer to the Deputy Prime Minister, because I know that her colleagues, Minister Monod and herself, are working with provincial territorial governments on this issue.
Thank you, Carla. On the top-up for essential workers, this is an effort that we are working on collaboratively with the provinces. The Prime Minister first broached it with the premiers at on the First Minister's call on Thursday. There was an enthusiastic response, and since then I've spoken about it with a few premiers. The Prime Minister has continued to be working on it, and the Finance Minister has been working on it with his colleagues. The Prime Minister intends to make this one of the key issues that we discuss and hopefully come to a resolution on quickly at the First Minister's call with the premiers tomorrow. So the idea is that this would be done collaboratively by the federal government and the provinces. Tu as raison, Marie, que le Québec a déjà fait beaucoup dans cet enjeu. Et vraiment, je peux dire,
in stating that Quebec has already taken action on this matter. Quebec has set a great example for the federal government and for other provinces. And Quebec will absolutely not be penalized for being the first province to act.
Operator, next question, please.
Notre prochaine question nous vient de Philippe Vincent Foisy de Radio-Canada. À vous la
Next
parole.
question, Philippe Vincent Foisy, Radio-Canada.
Bonjour.
Question.
J'essaie de comprendre.
Hello.
Avec l'armée dans les
There's something I'm
CHSLD,
trying to
je comprends
understand.
faut attendre
What
une
about
demande des provinces.
the
Québec
armed
n'a
forces
pour l'instant pas fait, à moins que je me trompe.
helping
Mais j'aimerais savoir ce que
in
vous,
long-term
le
care
gouvernement
facilities?
fédéral,
I understand that
offrez
we have to
comme
wait
aide
until the
aux
provinces
provinces
formally
avec l'armée
request
concrètement, à
such
part des
assistance.
médecins
But what are
militaires,
you,
qu'est-ce
the
que vous pouvez
federal
faire
government,
dans les
doing
centres
with
d'hébergement de
the
soins de longue
Canadian
durée
Armed
pour les
Forces?
provinces?
How can you help the provinces
Merci pour la
with their
question.
long-term care
Évidemment, les
facilities
forces armées
and
canadiennes
assisted living
ont des
facilities?
capacités
Answer, Minister
très
Duclos.
variées. En
The
passant,
Canadian
on a
Armed
tous compris
Forces
ce matin
can
de
help in
l'annonce de
a
M.
whole
Trudeau
host
qu'il y
of
avait
ways.
aussi une opération des
Prime
forces
Minister
armées avec les
Trudeau
Rangers
said
dans la
today
base Côte-Nord.
that
Donc, on sait
the
que ce sont pour
Rangers
des
are
activités
hard at
davantage
work
logistiques
in Canada's
pour
north.
assurer
They are
le
helping out
déplacement, pour
logistically.
faciliter
They are
le
helping
travail
people
collaboratif entre les
travel
municipalités
and move
et pour
around.
appuyer
They are
aussi les
helping
services de sécurité
municipalities.
dans
They are
cet
also
environnement
helping
où
out with
il y a
safety
à la
and
fois
security in
peu de
Canada's
gens, mais un
north,
grand territoire.
which
Pour
is
la
sparsely
question
populated but has a
plus
vast
spécifique
territory.
des contextes médicaux, donc des CHSLD,
Now,
évidemment, on pense
as
surtout
for
à
medical
l'usage des capacités
assistance,
des forces armées en matière de santé. Les forces armées canadiennes ont
as
effectivement
for the
des
Canadian Armed
capacités
Forces
d'intervention et
intervening
d'appui
to help
importantes en matière de
medically,
santé. Mais comme on le sait, ce sont
the Canadian Armed Forces can help out substantially when it comes to health. They would, if necessary, step in to support provinces and territories, but that would have to follow, as you've said, a formal request from Quebec or from a province.
C'est un peu ça la question. Je veux dire, concrètement,
Philippe
qu'est-ce que
Vincent
vous pouvez faire? Qu'est-ce que
Foisy,
les forces
follow-up
peuvent faire?
question.
Puis,
Tangibly
à quel
speaking,
moment
though,
elle pourrait
what
être
could
déployée?
they
Si Québec
do?
le demande, par exemple, demain
And
lors de
if
la
Quebec,
conférence, est-ce que
for example,
ça peut être
requested
fait
that
cette
the Army
semaine?
step
Parce qu'à
in
chaque jour
tomorrow,
où,
could the Army
on attend,
then
mais il y a des gens
step
qui meurent.
in this week very
Ce qui est
quickly because
absolument
people are
important, c'est de le
dying
faire en
now?
collaboration et en
Answer,
appui au
Minister
travail des
Duclos.
provinces. On sait que
We
le
must
Québec et
work
toutes les autres
with
provinces travaillent très
provinces.
fort dans la
Quebec
situation
and
d'urgence sanitaire
all
que nous
provinces
connaissons.
are
On sait que
working
c'est très
very
difficile
hard
dans les
to cope with the public
CHSLD à
health
travers le
emergency
Canada
that we
et
are
certainement au
experiencing.
Québec. On sait que le gouvernement du
And the
Québec travaille
situation is
fort pour
particularly
essayer
dire in
de faire en
long-term
sorte que
care
tous et
and
toutes
assisted
ont les
living
soins dont
facilities.
ils ont besoin. Donc, c'est
We are
vraiment une
trying to
capacité
ensure that
d'appui. C'est pour
everyone
ça que
receives the help and support that they
réponse, c'est
need.
que
And the
les
Canadian
forces
Armed
armées sont
Forces
là pour aider,
are a
ils sont là pour
support.
aider dans
They
un
are
contexte
there
où c'est
to
le
help
gouvernement du
and
Québec,
support
dans ce cas-ci, qui prend le
when the
leadership
provincial government,
et
so in
fournit
this
des
case
demandes
Quebec,
spécifiques aux forces armées.
makes a formal request
Merci,
for
Monsieur le
the
Ministre.
assistance
Opérateur,
of the
prochaine
Canadian Armed
question, s'il vous plaît.
Forces. Thank you very much, operator. Next question.
Merci.
Thank you.
Notre prochaine question est de Michel
Our next
Lamarche de
question is
TVA
from
Nouvelle.
Michel
À vous la parole,
Lamarche,
please go ahead.
TVA News.
Donc,
TVA
Monsieur
Nouvelle.
Duclos,
Go
je
ahead.
poursuis là-dessus très
Question.
rapidement. Pouvez-vous
I have a
confirmer
question
qu'il n'y
on
a
the
pas
same
eu de
topic,
demande
Minister
de Québec?
Duclos. Can you
On sait qu'il y a
confirm
des
that Quebec has
discussions pour
not formally
l'intervention des
requested
forces
the
de la division
intervention
médicale,
of the
mais il n'y
Canadian
a pas
Armed
eu
Forces?
de demande précise de la part de Québec à ce moment-ci. C'est bien ça?
So, is it the case that Quebec has not specifically made a request? Answer, Minister Duclos. Yes, that is accurate. Now, talks are underway between the Quebec government and the federal government, and these discussions could potentially lead to a formal request. We will always listen to the needs and requests of the Quebec government. If Quebec requests assistance from the Canadian Armed Forces or from the Medical Corps of the Canadian Armed Forces, then that will be possible. Answer, Minister Freeland. I would like to restate that we have not received such a request from the government of Quebec.
Deuxième question, ce serait pour le docteur New. Docteur New, on sait que la réflexion, elle évolue par rapport au masque obligatoire
Dr. New, we know that the science is constantly evolving when it comes to the usefulness of wearing a mask. Where are we now? What is our stance now on wearing masks, especially for the general public? In the upcoming weeks, will Health Canada or the Public Health Agency of Canada require that Canadians wear masks when they leave their homes? Answer, Dr. New. Thank you for this question. This is a live issue, a dynamic issue. It's constantly evolving.
Dr. Tam et moi, avec nos
Dr.
homologues
Tam and
du comité
a few days ago,
spécial, eu une bonne discussion.
Had a very good conversation with the other members of Canada's Special Advisory Committee on COVID-19.
Il faut vraiment distinguer
when it comes to non-medical masks for the general public.
Avec l'enjeu actuel pour les masques médicaux, parce qu'il faut
we have to,
absolument
in fact, distinguish
les masques médicaux
between
la protection,
non-medical masks
de protection
and medical masks. Medical masks are essential PPE for healthcare workers.
C'est toujours une option. On dit que c'est
as for the general public,
sort de la maison,
our stance is that wearing a mask is fine. Now, we have advised that Canadians only leave their homes when it's absolutely necessary to do so. And when Canadians go somewhere where it is not possible to practice physical distancing, for example, on public transit or at the grocery store, then wearing a mask is a good option, yes. But when we wear non-medical masks, we are protecting others. When we wear non-medical masks in public, it is because that is an action that we can take to protect others. However, these non-medical masks do not protect us from others. So our stance has not changed in that sense. Thank you, Doctor.
Okay, we'll turn to the room, starting with Julie, CBC.
Julie Van Dusen, CBC. Dr. Tam, when you said the epidemic is slowing down, my ears kind of perked up, but is there any reason to get optimistic about this when it doesn't sound like there can be any change in behavior?
Yeah, I think what I said was cautious optimism. I think what we're doing is working, and you're seeing that slowdown. But I didn't say we reached the peak, and I've always said on the other side of that peak, you have to be really vigilant. If you do not, then you experience a resurgence. We've got many challenges still to deal with, including managing the outbreaks in long-term care facilities, etc. So I do think that the epidemic growth rate has slowed for sure. But the main message for all Canadians is actually not to let go. Lâche pas la patate, comme je dis avant.
Let's never give up.
This is not the moment to let go. You're doing a great job. Let's continue that until we can get to the bottom of that hill and then look at what that new normal would look like.
Okay, and I guess my second question would be for Mr. Duclos or perhaps the Deputy Prime Minister. We talk a lot about nursing homes, and it seems to be a lot of talk and not a lot of action. Canadians are devastated by what's going on in there, especially those who can't visit their loved ones. We all know that we would never let a pet suffer this way, much less a loved one. So you call it a war, and a lot of people are wondering, where are the soldiers? Why don't you send them in? Perhaps with the help of the Red Cross on a humanitarian mission to serve meals, to help out just during the pandemic. What kind of possible bureaucratic excuse could there be not to?
I'll start, and certainly the Deputy Prime Minister could add if she wishes more. I first of all agree with your assessment that we have to do a better job collectively as governments, and I think this is no secret to people, as I said yesterday, who have experienced a loved one who's lived in long-term care. There are a variety of different levels of long-term care, but some of them are quite atrocious, as you pointed out, and I think this is an opportunity for all of us at all levels of government to reflect about how we will do a better job. In terms of our immediate response, I've had conversations both with my both counterparts, Minister Elliott from Ontario and Minister McCann from Quebec, to talk about how we can support them in the short term, including as we've mentioned, resources to top up wages for long-term care workers so that they have what they need to stay in one place and not have to work in multiple places over multiple sites, but also in helping them with the significant human resources crunch that they're facing right now. And so Health Canada has, as I think I announced a couple weeks ago, a portal that thousands of Canadians have applied to help. And so we are working closely with both Ontario and Quebec to match them with the appropriate resources to support them in long-term care homes and other ways that they might need within the healthcare system. And in fact, just checked with my deputy, and there's about 1,000 people right now that would be available to support Quebec that speak both official languages. So that work is happening right now. And I think there's two stages. There's a short-term stage, which is doing what we need now to actually put the tangible pieces into place that will protect people living in long-term care homes, but also people working in long-term care homes. And then secondly, how we work together to build up a much more humane system for all people who are aging in Canada.
Okay, Marika?
Marika Walsh with the Globe and Mail. I'm just wondering, this is either for Dr. Tam or Minister Hajdu, how many warehouses or stockpile locations do we have for the National Emergency Stockpile across Canada? And how has that changed, say, in the last 20 years? Has it gone up or down?
I think I'll turn that to Dr. Tam, as I, believe it or not, before the pandemic was the Minister of Health for a month and a half, so I don't have the history that perhaps you're looking for, so perhaps Dr. Tam does.
Yes, so I think in the past decades, the NES actually stockpiled a lot of things like cots and blankets and that type of material. Those were sort of reduced over time because other people can provide some of those, but we still deploy them. And they are scattered across the country. And we have at least 5 regional warehouses for general supplies. But the national stockpile over the years has been much more focused on stockpiling very strategic medical supplies that nobody else actually holds. And those are very specialized, and it's held in one single warehouse, basically, where there's very specialized conditions to maintain those medications or vaccines.
So can you just confirm, does that mean there are a total of 5 warehouses in Canada, and what was the highest number? And my follow-up question is on CBC's reporting that the warehouse in Regina was closed and that masks were thrown out. Were those masks replaced, and why was that specific warehouse closed?
I asked my officials that question this morning when I also read the story about the destruction of expired masks in the Saskatchewan warehouse. And we'll be reviewing the practices of what we do with equipment that is near to expiry, because I believe there is probably a more effective way to use equipment that is nearing its expiration date. Certainly that was pre-pandemic, and I understand the reluctance of Public Health Agency of Canada to distribute equipment that in any way has expired in normal times, because of course the first focus is the safety of the people that will use that equipment. But there may be opportunities to, and I'm certain actually there's opportunities to look at a process where that equipment is offered either, first of all, to parts of Canada that may not have easy access to that equipment, and if not, then overseas to other countries that may need it. So we'll be reviewing that practice. The number and nature of the warehouses, I will get back to you on that information. I take Dr. Tam at her word that it's 5, but we'll confirm for you.
There's some locations where there's more than one actual physical building, but there's essentially, but we will absolutely verify that, because even for me, some of those changes because of logistical requirements, but definitely confirm that.
Thank you, Doctor. Henny?
If I could just ask, and one more thing. When I asked about the nature of the warehouses early on, I will say that they are considered to be an issue of national security. So releasing the exact location of warehouses is not a practice that the Government of Canada has ever had, because, of course, these are strategically important resources during times of pandemic or other kinds of disasters.
Hi, it's Annie Bergeron-Oliver with CTV National News. My question is for Dr. Tam. The percentage of people who were testing positive seems to be increasing. In the first week of April, we were around 3.5%, and at that point you said that was a good range for Canada to be in. Now we seem to be hovering around 6%. I'm wondering what attributes for this change in the percentage and whether Canadians should be concerned that more people appear to be testing positive for the coronavirus.
Yes, I think the percentage positive is a combination of different factors. One is how the provinces are targeting the testing. So obviously targeting high priority situations where there are outbreaks, that will get you more percentage positive potentially. But what we want is a sensitive enough system where significant numbers of people perhaps with milder symptoms are still being tested. So you still have 94% that are not positive. So it shows that the country is still testing a lot of people who in the end didn't turn out to be positive, but that shows a certain amount of sensitivity in the system. But that's also a composite of the country. So those might be different depending on the location or the jurisdiction because of the different epidemiology as well. So it's a combination of things. I think globally, what is suggested is anywhere between 3 to 12% is the sort of range that people have been using as a system that has a sort of right balance of targeting the right population, but also being sensitive as well. But we, as we've all said, we need to improve the lab capacity in Canada, and we're going to continue to do that.
Okay. As a follow-up, every day it seems like we're hearing more cases of healthcare workers who are being infected. And I'm wondering, one, if you have an exact picture of how many healthcare workers across the country are currently infected. And two, what is the federal government doing to ensure that hospitals have the staff they need as more healthcare workers get sick? And the same goes for long-term care facilities.
Well, first of all, and I'll turn to Dr. Tam to speak about specifics in a minute, but I will say that the work that we do at the federal level around staffing of hospitals and process and protocols for hospitals is at the technical guidance level. Dr. Tam and Dr. New, as you know, sit on the Special Advisory Committee, which is comprised of all of the public health officers from across the provinces and territories, and it is there where the guidance gets developed in partnership with all of those experts across the country. The federal government has provided a number of resources. I always say that we are able to provide money, which we have, to provinces and territories. We are able to provide equipment, which we have, to provinces and territories, and guidance. And that is really the role of the federal government. And of course, any other extra special requests that each province and territory poses, like, for example, human resource support, we are working very diligently to provide that as well. I don't know if that's complete enough, but I can certainly give it to Dr. Tam to speak a few extra words.
I think it is actually quite important to look at the number of cases in healthcare workers, which the provinces have much more detailed information on. Of the provinces that have provided us with information that we can glean, the percentage of cases that have been in healthcare workers ranges somewhere between sort of 7% to sometimes 11%. In general, and the exposure setting, if you like, is actually quite varied. A lot of them are actually infected not at the workplace. Sometimes it's due to travel, attendance at a conference, attendance in certain mass gathering events, and certainly into the more social context as well. So I think what that tells us is, of course, we need to protect healthcare workers, both at the workplace, but it is also important for them to reduce all of their risk of acquiring infection elsewhere, I think, as part of their other daily life as well. So I think both aspects of protecting healthcare workers are important. Of course, travel and mass gatherings have now been considerably reduced. I know of even one cluster where it involved a funeral setting where there were some healthcare workers as well. So it's actually quite varied in terms of where they acquire infection. We know to date of one health worker who had unfortunately died with COVID-19. It is unclear, I think, where that worker, who is, I think, an environmental staff, had acquired infection. It may not be the workplace, it could be in the community, but that's sort of under investigation by the jurisdiction itself. So I do think that this is something that we are monitoring, I think, in every area of Canada very closely.
Thank you, Doctor. We'll now turn back to the phone for two last questions. Operator.
Thank you. Our following question is from Jim Bronskill from the Canadian Press. Please go ahead, à vous la parole.
For Dr. Tam, it seems many say that a rapid testing capacity that's many times what we have in Canada right now is a requirement for a return to anything like normal. First, do you agree with that? And if you do, can you lay out in detail what's being done to get us to that point?
So I think certainly when there are bigger outbreaks or clusters, what you're testing is trying to determine if an outbreak is occurring, and looking at community transmission. When we get to epidemic control of the first wave, which is our collective objective and our goal, you have to have sensitive laboratory testing. You have to have good testing systems so that you can detect any reigniting, if you like, and the sparks and clusters reoccurring. So for sure, ramping up our capacity in anticipation of that period of time where we had to detect further chains of transmission is very critical. So we are doing this in a number of ways. One is every single day looking at every avenue to increase our capacity to do the detection for the virus, which is mainly the PCR test. So those are the tests that could be done in bigger laboratories, but also smaller ones, but then the rapid test that can detect the virus as well. So absolutely pursuing that, including, of course, domestic supplies, such as the Spartan company that is providing, this is one that Health Canada had recently approved. So trying to get as much of that diagnostic on board, and that would be really a sort of great component of our strategy for those who are more in the remote and rural areas, Indigenous communities, because that will eliminate the transportation time for any specimens. But for sure, any of those types of tests we're pursuing. Making reagents, ensuring we have swabs, all of those things are being worked on every single day by every laboratory. We have to thank the laboratory people, by the way, today, and all that they're doing to help us in this outbreak. Also, then, of course, we are examining the antibody tests. And people have asked us that, about that in the past. And we are actively testing some of those kits, doing quality assurance, making sure that they can actually detect antibodies. and then further understanding the immunology of the virus. So I think all of those streams of capacity building are relevant.
Thanks. And for Minister Hajdu, what do you make of the U.S. President's comments about the World Health Organization and the withdrawal of funding? How will this affect the fight against COVID-19?
Well, I think Canada values the work of the World Health Organization, and we continue to commit to contribute towards the work of the organization. It is a very valuable tool when in regular times, in both its ability to detect new virus activity, to manage outbreaks of a variety of different diseases around the world, to bring scientists and researchers together, to allow the capacity for countries to work together to deal with these types of outbreaks. And so we commit on a regular basis through the presence of Dr. Tam as one of the expert advisors to the committee, this special committee on COVID-19. And we know that any response to COVID-19, and in fact, really any global outbreak, is one where countries have the capacity to work together and to pool their research and to really share their efforts to manage these outbreaks that will happen again and again and again, by the way.
Thank you, Minister. Operator, next question, please.
Thank you. Our following question is from Lauren Gardner from Politico. Please go ahead, à vous la parole.
Thanks for taking my question. The Prime Minister said yesterday that border restrictions are going to be needed for weeks. Many states in the U.S. have extended stay-at-home orders. How long is Canada looking to extend the current limitations in place for non-essential people not crossing the border?
Thank you for the question, Lauren. Well, you will have heard from Dr. Tam and Dr. New that they are cautiously optimistic when they look at the doubling rate of coronavirus in Canada. And I would just like to echo their comment that Canadians have been great and really disciplined. And I am so grateful to Canadians for their excellence in committing to physically distancing, and that does allow us today to be cautiously optimistic. You've also heard from our public health officials that we recognize in Canada that we still have a considerable way to go, and we are going to be absolutely vigilant and fierce about not squandering the tremendous sacrifice that Canadians have made and not squandering what that sacrifice has accomplished. So, and I'm just so grateful to Canadians who have been so terrific, and everyone has made a sacrifice. And I'm really pleased in a cautious way that we are able today to say that we're cautiously optimistic. That is really precious. That is hard won. And as you heard from our public health officials, we are going to be very careful and thoughtful about how we move from here. We're not going to waste the hard work that people have done already. In terms of what that means on the border, as the Prime Minister has said, as I said yesterday, Canada believes that we need to extend the restrictions that we agreed to with the United States in a really terrific collaborative process last month. And we are working with our American colleagues to do that. We think it's premature to set a specific date and to promise that for sure this will be the day when things can be lifted and we can go back to normal. But we have a really great collaborative relationship when it comes to the border and many, many other things. And those restrictions that Canada and the U.S. put in place at the border really, really are working. Travel is down a lot, which is the right thing. And at the same time, essential travel does continue.
And for my follow-up, I I know you can't give a specific date as to when things will return to normal, but could you, Deputy Prime Minister, and maybe also Dr. Tam, talk about what you would need to see both in Canada and in the U.S. for these types of restrictions to be loosened, even if not fully taken away?
So I think our singular focus is to get epidemic control of this initial wave. So I think we must absolutely stay focused on that. We're not close to that. And so I think you cannot emphasize that too much. Of course, we'll be closely monitoring the epidemiology on both sides of the border because once you get the epidemic wave or epidemic control of the initial wave, we won't be back to completely normal. We know that the Canadian population is not going to be immune. There's a lot of people that's not going to be immune. And whatever we get back to is not going to be the same as before the actual pandemic. As to what that new normal might look like, we have to just tread cautiously in order to sort of get there. But so then after that, one of the key risks for igniting change of transmission, of course, then becomes importation, which means that we have to watch that really carefully and have all the measures such as the mandatory order that we had put in place yesterday, not just for symptomatic but asymptomatic travelers to undergo the period of quarantine. So all of those are this kind of systematic capacities you have to put in place before you can do anything else. And I think as I said, having all those preventive measures, making sure our health system is ready should there be any resurgence, making sure that when we talked about our noughts, we're looking at the sort of effective reproductive number so that there's no ongoing expansion of any further introductions is extremely important. So we need to get that laboratory capacity up. We need to make sure case contact management is strong. All of our domestic wave is epidemic controls underway, and our population is fully prepared before we cautiously look at some of those next steps. So that's at least the public health advice.
Yeah, and the only thing I would add is, we have been managing the Canada-U.S. border in a remarkably collaborative and reciprocal way. And I think it's a really good example of good neighborly behavior. In introducing these restrictions, we have been protecting each other, and that is going to be the approach that we continue to take.
Thank you, Deputy Prime Minister. We'll take one last question on the phone, and then Mike will come to you. Operator?
Thank you. Our next question is from Lena Dib from La Presse Canadienne. À vous la parole. Please go ahead.
Question, Lena Dib, La Presse Canadienne. I have a question for you, Deputy Prime Minister Freeland. The Conservative Party of Canada continues to insist that the House of Commons be reconvened, even with reduced quorum. Are you considering proroguing Parliament or not? Answer, Minister Freeland. We recognize just how important Parliament is, and we recognize the importance of opposition parties. Parliamentary debate is very important, especially in a parliamentary emergency, in any emergency situation. We met on Saturday, we reconvened the Parliament, and our House leader, Pablo Rodriguez, is in talks with other party leaders and party health leaders to determine what we will do in the future. We are all collaborating across all parties. We understand that we are in a crisis and that we must work together. I'd like to add that we are all aware of something very important.
Très consciente que nous avons une obligation
we must all remember that we have the duty to protect the health of Canadians. We must, of course, protect our own health as members of Parliament, but it is our duty to protect all workers who work here on Parliament Hill and make it possible for us to work. Follow-up question. You haven't answered my question. Are you considering proroguing Parliament?
Doubling every over 10 days. I wonder how reliable that number is when you consider the very small amount of testing that Ontario is doing. Why are you relying on that data?
Lina, je peux seulement ajouter qu'on est en train de discuter l'avenir de la Chambre des communes. C'est une discussion dans laquelle les leaders sont les leaders de tous les partis dans la Chambre. Notre gouvernement comprend l'importance du Parlement.
Talks are underway with leaders and House leaders of all parties. Our party understands the importance of parliamentary debate and the important role that the opposition has to play. That said, we want to protect our health and the health of all those who have to be here in the House of Commons when we work.
Yes, so in terms of the growth of the epidemic, this is at the national level, and as I think I've pointed out before, that this is a composite of actually many different epidemics across the country. So you're correct, you need to sort of look at the individual provincial piece as well. And we're always cautious about this. It's only one component of what we look at. But what I can tell you is that our daily testing rates haven't gone down. I mean, they are continuing to be sustained or improved upon. Every province, including Ontario, is trying to increase their testing. So that actually has not come down, while the epidemic growth rate itself has actually, the length of time has grown, which means it's slowing down. So that's why we are being cautious, very cautious as usual. And a phrase that I use, and I don't know where I got it from, somewhere anyways, is that we're cautiously not entirely unoptimistic. So that's about where I think we're at, but it is only one element of all the dynamics that we look at on a daily basis. Thank you.
Thank you, Doctor. Mike.
Hello, Mr. Duclos. Has the federal government received a request from the Manitoba Premier Brian Pallister to allow non-frontline provincial government workers to qualify for the employment insurance if their work time has been reduced because of this?
Well, I'll turn, if that is fine, Mike, the question to Minister Qualtrough, who is probably on top of this important question.
I thank you for your question. We've had a number of public sector employers reach out to see how they can be supported, either through EI work sharing, through perhaps the wage subsidy, and I know that there's ongoing discussions at various FPT tables, in particular about how we can perhaps work to some resolution of this, but there's been no decisions made. I know the conversations are ongoing, and I don't know if the Deputy Prime Minister has anything to add.
You know, what Carla says is an accurate reflection.
Okay. And is this something that's workable in the long run, or is that still under discussion?
Under discussion.
My quick answer to that would be under discussion.
Okay, thank you. Merci. Ceci met fin à la conférence de presse.
That concludes today's press conference.